Medical Missionaries started approximately 20 years ago in 1997 at the request of a missionary stationed on the border between Haiti and the Dominican Republic. I was asked to assess the healthcare situation of that area and over a course of 6 months put together a small team of doctors and nurses, and we eventually wound up spending 2 weeks in the mountainous area on the border between the two countries. At the end of that trip, we had seen approximately 3,000 people, and we had administered 2,500 vaccines to 2,500 children, who none of which had ever seen a doctor before. It was quite apparent that what we had accomplished was significant, but it also was apparent that if we wanted to provide real sustaining change, that continuity would be the most important, crucial issue. Medical Missionaries consists basically of 4 major programs. The first program is the operation and maintenance of our clinic hospital in Thomastique, Haiti, and also our work in the Dominican Republic.
The hospital has become a vital health resource, serving over 22,000 patients in 2016.
The second program involves a warehouse that we have in Northern Virginia, and from there we send sea containers of health-related items worldwide to build infrastructure in the third world for very poor areas that have no health care. The third major program is that of distribution of pharmaceuticals, which we get predominantly from Project Hope and the Catholic Medical Mission Board in New York. Receiving these bulk medications allows many more people to be treated. The fourth program is educational. Periodically we have a conference and they discuss the current updates on a whole variety of problems, which they then take back to their teams and to the respective clinics worldwide. In addition to 4 major programs, there are sub-programs that are involved, particularly in our hospital in Haiti. One of these is the water purification system, Chlorfacil, which was now instrumental in saving many lives in that area by treating water that is obtained from rivers or elsewhere with chlorine in a closed system. The MATWAN program is a sub-program too in Haiti. Involves a relationship with Midwives for Haiti, where nursing personnel are trained in the aid and delivery of babies to women in the areas. The third program is the Medica Mamba program, which is a special peanut butter type of preparation that's given to very severely malnourished children. The children that receive this and survive for the next 6 weeks usually go on to long-term survival. And in the past, without this program, many of these children would die. The fourth program involves a salt program, a fortified salt that's fortified with iodine and DEC, which is an abbreviation for a special chemical used to treat endemic filariasis, which is a parasitic mosquito-borne disease that leads to marked swelling of the legs and scrotum and other areas of the body, very disabling and disfiguring. Volunteers are the heart and soul of our organization. The volunteers have made so many things possible in so many different ways, and let me just allude to the fact that we've had probably 300-400, perhaps even more, volunteers over the years. Some of these have unfortunately passed on at this point in time. Others have retired or, like me, gotten old and become a dinosaur. But the ones that have made it work are the people who have spent their time and talents on working with and for medical missionaries. Being a totally volunteer organization has allowed us to do so many things in one sense, because every dollar donated, 99 cents or more of a dollar goes to a project, since we're not paying salaries for anyone. Our volunteers fall into mainly three major categories. We have obviously the professional group of people composed of medical doctors, surgeons, dentists, and all the associated nursing personnel that goes with the various specialties.
Typically, our team goes down in January, February, or March, and we take about between 13 and 15 individuals, medical practitioners, volunteers, usually a general surgeon, a urologist, sometimes an orthopedic surgeon, several recovery room nurses, and then pre-op nurses and other volunteers, usually students, to help do some of the grunt work of our team. This past trip, we performed 66 operations.
We went with a group of 10, and that included 4 physicians. And the group did a number of things. For one, I think they did at least 4 or 5 mobile clinics in Haiti and a couple in the Dominican Republic. And we certainly saw, several hundred people.
This particular trip, we actually treated almost 800 to 1,000 patients between 4 caregivers and our support. And I have to admit, the support is probably the most important part. The medicine is the easy part. It's the people that help us.
It's like a land without toothbrushes. So you can imagine that people have have toothaches for 2 years at a time, and unless we're down there, they really kind of live with their toothache, and that's the least of their problem.
Each year we apply for a grant, and if we're granted the award, we do something on the order of 100 metric tons of food aid that feeds about 10,000 people in the 60 or so communities around Bonica and Pedro Santana, Dominican Republic, and is focused on providing nutritional assistance to the pregnant, elderly, children, and the sick in those areas.
Although the work of medical missionaries started in the Dominican Republic and Haiti, the organization has served the poor and distressed all over the world. In Latin America and the Caribbean, medical supplies and disaster relief have been sent to over 10 locations. 16 countries in Africa have received shipping containers filled with needed supplies and equipment. Even countries as far away as Asia and the Middle East have benefited from the good works of medical missionaries. And the help has not been limited to foreign locations. Aid has been sent to disaster sites here in the U.S. after storms and floods. Wherever there is a need, medical missionaries works to help relieve pain and suffering. They are only limited by the resources they are able to raise.
600 miles off the coast of Miami, people go without food, without running water, without electricity, without basic health care. And the little money you can donate to this organization really helps, because it's all volunteer. No money gets spent on anybody. Everybody volunteers their time and money for supplies and airfare and everything else.
People often ask me, how can I become involved? You can become involved, like a lot of people, by joining the team either in Haiti or here, the prep area. A lot of work is done getting ready to go. But one of the things that most people can do when they can actually see the poverty that we deal with and how a little bit's a lot is to make a contribution. And the contributions make it possible for us to do what we do. So get involved. Okay, reach down deep in your pocket, because every penny that you put out there doesn't go to the administration. It goes to the kids in Haiti and the people in Haiti that really need it.
We need your help and donations to continue this work. It is important that you make a donation to support this work for the future. What happens in the future really depends as much on you as it does on us, and we need your help. God bless you for making a difference for so many unheard voices. Thank you.
Si je vous fais noir, c'est pour courir tout de suite à notre dispensaire.